tremor in his lip and tongue were gone, 100% gone. His bladder frequency, where he was going to the bathroom in the daytime 10 to 15 times per day, he was now only going 5 times a day. His left leg stiffness, which was a 2, the leg stiffness is now a 0. The right leg stiffness was a 10, and he also had pain in his hip on the right side. He told me that the right leg stiffness is now down to a 3. It was a 10, and now it's down to a 3. That's a 70% reduction in the stiffness in the right leg after his first protocol. And the pain in his hip is completely gone. He also said that the stiffness that was in his neck, which was a 5, 0 to 10, 10 is the worst. 0 means no stiffness, 10 is the worst. He was a 5 in his neck stiffness before we started our work together. His neck stiffness now, sometimes at a 2, most often is at a 0. He said that his spirit has improved greatly, and because one of the things that he noticed is now he can think clearly. His brain fog that he was suffering, brain fog, which he could not think clearly, his brain fog is completely gone. 0 brain fog. Are you diagnosed with Parkinson's disease? Do you have a movement disorder? Possibly when you move your arm, does it tremor or have what's called a bradykinesia, where you can't move the arm or hand appropriately, or the leg? Do you have a tremor that's just going on where you have uncontrolled movements? You're trying to sit still, but the arm keeps moving on its own, or the leg moves on its own? Do you have a problem where the fingers, maybe you're doing the pill rolling type of situation or symptom or expression of a neurological disorder? My name is Dr. Lonnie Herman, and in this video I'm going to share with you changes, positive changes that are taking place for a gentleman who's coming to my clinic. He's 46 years of age, married with children, came to my clinic in South Florida, where I practice presently, from California. He also came for his second consultation and second examination. I will be sharing with you in this video the difference between the physical changes that he's experiencing, positive physical changes, between his first visit with me, which was April 6th of 2017. I'll be sharing with you the follow-up examination and consultation that was August 11th of 2017. So we're about a 4-month difference between his first visit and his second visit. And I'll also share with you the symptoms that he was experiencing in the beginning, as well as changes to the symptoms that he's, the relief of those symptoms, as well as exam findings from the first examination from August 6th of 2017, and the exam findings from his second visit, August 11th of 2017. Today is August 21st of 2017, and I don't have any follow-up with him yet from his most recent examination, because he's going to have a 2-month, he does have a 2-month protocol to follow from this second examination. And so when he comes back, we'll share the changes that have occurred between his second and now third visit with me. When this man, 46 years old, diagnosed with Parkinson's, when he first came to visit with me, and before we had our visit, we had a consultation that was handled by phone and long distance. And one of the symptoms that he had was tremors happening from the arm, from the right arm, from the shoulder down to the hand, stiffness in both legs, much worse on the right side. He had tremor in his lips and his tongue. He had a dystonia, a muscle tightening that was in the right foot. He had a bradykinesia, the right hand and wrist. When he would try to move the hand around like this in a smooth movement, there were interruptions in that smooth movement, or you can call a tremoring or a movement disorder. And when he came back from after his first protocol was completed, he came back here for his second consultation and second examination on August 11th. And he told me that his tremor in his lip and tongue were gone, 100% gone. His bladder frequency, where he was going to the bathroom in the daytime 10 to 15 times per day, he was now only going 5 times a day. His left leg stiffness, which was a 2, the leg stiffness is now a 0. The right leg stiffness was a 10, and he also had pain in his hip on the right side. He told me that the right leg stiffness is now down to a 3. It was a 10, and now it's down to a 3. That's a 70% reduction in the stiffness in the right leg after his first protocol. and the pain in his hip is completely gone. He also said that the stiffness that was in his neck, which was a 5, 0 to 10, 10 is the worst, 0 means no stiffness, 10 is the worst. He was a 5 in his neck stiffness before we started our work together. His neck stiffness now, sometimes at a 2, most often is at a 0. He said that his spirit has improved greatly, and because one of the things that he noticed is now he can think clearly. His brain fog that he was suffering, brain fog, which he could not think clearly, his brain fog is completely gone, 0 brain fog. One thing, and there was a couple of other findings that I'll leave for another discussion when I do actually have this gentleman, when we could see the hand movement get back to normal, the wrist and hand movement get back to normal, which will be able to discuss this with himself, maybe even his wife can share these changes with you on camera. But I asked him, when he shared with me all of these positive changes, even though the arm is still tremoring and the hand is still not moving smoothly, which on his second consultation and examination, I performed some very unique functional neurological evaluations of his cerebellum. And the cerebellum has specific centers, nuclei, which control the wrist and the hands, as well as the hips and the leg, the elbow and the whole arm and the shoulder. So I provided him with specific functional neurological therapeutic rehabilitation exercises, which are going to, because I could see the positive changes when he was on the exam station right here in my clinic. We could see the change right there, although that there's much more rehab to be done in order to really make those changes, so to speak, set in stone, if you will, to rehabilitate these specific nuclei in the cerebellum. But I asked him one thing. With your bladder frequency going down from 10 to 15 times a day now to 5 times a day, with the tremor in the lip and tongue gone, with the leg stiffness that was a 2 down to a 0, with the right leg stiffness from a 10 to a 3, with the pain in the hip now that was there gone, with the stiffness in your neck 5 to a 2 or a 0, most often a 0, with the brain fog that you suffered gone. With any doctor you've been to in the past who was going to prescribe a medication or whatever else they were going to offer you, or did offer you, did you ever notice any positive changes? And the answer was no. So what I'm pointing out to you all here who are watching this is that when we can actually find and remove safely the infections and the toxins, the hidden infections and toxins in specific tissues in your nervous system, in your bone marrow where the stem cells are that make your blood, in your liver, in your spinal cord, in your meninges, in the cerebellum, in parts of your brain stem, even where the dopamine is made. When you can actually find, when I can help you find, pinpoint these infections, hidden infections that are hiding, that are not going to be revealed in a blood test or a genetic test or a stool test, that are not revealed in these tests. When you can find the infections and toxins in specific tissues, which I'll get into his first examination in just a moment, where you can find those specific infections and toxins and provide a safe and effective, which I do with every patient who comes to my clinic, safe and effective method, remedies that will remove those specific infections and toxins that we pinpointed from the specific tissues where they're located, then restoration of function will take place. And so we're noticing great relief of symptoms. Tremors are not gone yet. One protocol, still dramatic changes already for other symptoms that he's been suffering from. The tremor, the bradykinesia, that's going to go away, I'm certain. And just with the right amount of time, with all of the tissues that can be, all the different layers of infections in the tissues that need to be cleared up, we're getting it done. And we will see the symptoms change. Let me get into his first protocol, and then again, I'll get into his second protocol. And let me tell you first, before I get into this first protocol, there are specific tissues that we need to investigate when it comes to movement disorders. One of them is your thalamus. I'll put a picture up here next to me of the thalamus. The thalamus is a tissue that has to ignite certain parts of what's called your cortex of your brain, where you have upper motor neurons. In order for you to have specific functions in an upper part of your body, you've got to have these upper motor neurons getting the normal bit of information. They can't get excess of input. So what can happen when the thalamus gets infected from some infection coming from a root canal in your mouth, or infection from another part of your body, or infection from your gums, or out of the gland that makes the saliva, maybe that carries an infection over, or maybe sinus infections can carry over, or stomach infections can carry up into the brain. Literally, you can get infections in the thalamus of your brain and the thalamus will fire at such a high rate, and then we can get excess signals going up to these upper motor neurons, and that can cause excessive uncontrolled movements when you're trying to sit still and the hand keeps moving, the fingers keep moving, the leg just moves on its own. So one tissue is the thalamus. The second tissue I want to discuss with you is called your reticular formation. I'll put information up here on the side of the screen about the reticular formation. This tissue is a very complex net web of nervous system tissue located inside your brainstem. This is actually a great integral part of where neurotransmitters like that of dopamine and serotonin you might be familiar with, where these neurotransmitters are made. 90% of the information coming from your brain to get down to tell your arm how to move or your leg how to move has to go through this reticular formation. You've got to be able to have normal sensory and motor input and export from through this reticular formation. And in order for the thalamus that I just mentioned a few minutes ago, in order for the thalamus in the brain to be able to send the signal up to the cortex of the brain to carry out signals through the rest of the body, we've got to have the reticular formation that sort of ignites. It's like taking a lighter and lighting the wick on a firework so the firework can go up to the sky. We've got to be able to light that wick, otherwise the firework will just sit stuck in the sand on its stick. Well, the thalamus will not carry out so much information when it doesn't have input from the reticular formation. So we've got to have that reticular formation clean of infection and toxin. Otherwise, we can have malfunctions in the nervous system, including but not limited to blood pressure disorders, whether it's high blood pressure or low blood pressure. Some people with Parkinson's have high blood pressure, some low blood pressure always, and some have a normal blood pressure. But the reticular formation must be clean of infection and hidden infections and toxins causing its malfunction. The thalamus must be clean of specific hidden infections and toxins unique to you that are causing your malfunction or may be causing your malfunction. You have another tissue in your brain called the Globus Palladus. I'll put more information up to my side here. The Globus Palladus is a tissue in the brain that is sort of like putting a leash around a dog's neck when the dog is acting, when the dog won't pay attention to you. When you call the dog by his name, let's call it Rover, and the Rover won't sit down or Rover won't come to you. But when you put a leash around Rover's neck, Rover sits, stays, listens to your instruction. So the leash was the answer to get Rover under control. Well, the thalamus, when it's firing too high, when it's over-firing, which it needs to be inhibited, it needs to be like a leash on that dog or like reins on a horse. The horse is going out of control, so they pull the reins down so that they can control the horse. The Globus Palladus is like that, like the reins on the horse or the leash on the dog. The Globus Palladus it inhibits the excitement of the thalamus so we can have smooth movements with the limb. So we don't have limbs that are moving out of control on their own. The Globus Palladus is one really important tissue to examine. Another one is called the substantia nigra. Again, let me just tell you, every bit of information, I'll use this area next to me so I could show you some images or use words here to help educate you and help you inform you. The substantia nigra has a large series of cells that are dopaminergic or dopamine producing cells. We want to make sure that the substantia nigra is clean of infection and toxin. Your cerebellum, which controls parts of your limbs, your shoulders, your elbows, your wrists, your fingers, your hip. In order for these different tissues of these parts of these extremities to work normal, we've got to, even your ankles, we've got to have these different individual parts of the cerebellum working normally. When the cerebellum has infection or toxin, hidden infections and toxins that won't show up in a blood test or an MRI, or a CAT scan, when these infections and toxins are causing the cerebellum to not work well, no matter what therapy you do for your brain, until you remove those infections and toxins, no matter what therapy you do, nothing's going to work. You've got to remove these toxins like mercury, like lead, like arsenic, like preservatives, like insecticides, like anesthesia chemicals can stay in the body after a procedure and destroy the tissue's function. You are what you eat. Anything that has gone into your body will absorb into your tissues, even tissues in the brain, and cause the brain to not work well over time or immediately. There's another tissue in the body, or in the brain, called the basal ganglia, the corpus striatum. These tissues help us manage controlled movements. or control our movements. The frontal lobe of the brain is also in part with controlling motor function. Right brain, left body, left brain, right body. We've got to make sure that the frontal lobe is up to speed in carrying out its functions. You've got another part of your body we've got to think about, or in the brain, called the red nucleus. The red nucleus, we've got so much information that goes through parts of the brain that get to the body. If the red nucleus, when the red nucleus has hidden infections and toxins, destroying its ability to transfer the signals from the brain to the body, we can have a problem with the function or malfunction in the tissue of the extremity. Your another tissue, the motor neuron that carries the signal out, the motor signal to the extremity. What if that's infected with some kind of infection, or that's got a toxic overload by some kind of metal or mercury or anesthesia chemical or insecticide chemical or preservative chemical or pesticide or antibiotic residue or something like that, that is causing the tissue to not, the red nucleus to not be able to carry out the signals to parts of the body and make you control your limbs appropriately. The spinal cord can have an infection or toxin, even without having an inflammatory fever kind of episode where you're in the hospital with a really stiff neck or some kind of meningitis type of diagnosis. You can have infections and toxins in any one of these tissues. Hopefully I didn't miss one right now in this description. But you can have infection and toxin in these tissues that are causing your body to malfunction. And my job, and what I can do with my very unique set of skills and very unique tools in my clinic, without doing any invasive procedure into your body, I can perform a very unique stress reflex analysis. And with your body, there's more to it that I'll describe when I get to discuss with you in a consultation, but I can actually find in your Globus Palladus what kind of infections and toxins, which I'll list for you first with this gentleman, which kind of infections and toxins cause the Globus Palladus to not be able to, like, put the reins on the horse, to be able to calm down the excessive overfiring of the brain, or of the thalamus, let's say. What if the thalamus is functioning normally, but we have a weak controller that still, it doesn't have to be an overfiring thalamus, we might just have a weak Globus Palladus that is not that it's not controlling the thalamus. You might have overfiring of one and underfiring of another. You might have more than one tissue that's overfiring, another one that's not able to inhibit that function in your brain. So that's a brief overview of what we've got to be able to start to assess in your body to help you clean up your tissues in your brain and start to regain normal function with this work. In this man, again, one more time, let me repeat his symptoms. He had the tremor in the tremors with the right arm from the shoulder down. He had the stiffness in his legs. He had the tremor in the lip and the tongue. He had the bradykinesia with the wrist and the hand. He had the frequency of the bladder. His Globus Palladus was his first tissue that came up in this examination, and he had specific kinds of bacteria. He had scabies infection, he had E. coli infection, he had organochlorine pesticides, he had strep infection, he had staph infection in his Globus Palladus. He also had a cancer-causing food preservative called EDTA, a cancer-causing food preservative in his Globus Palladus, diseasing the function of that Globus Palladus. I also found in there an insecticide called malathion, a terrible, harmful insecticide that was absorbed in his body, in his brain, by foods that he's eaten over the years, as well as the cement filling from a tooth, which is also toxic. It's not just silver mercury fillings that can cause harm to the brain, but even toxic cements and composites, which I also keep those samples from a dental laboratory. I keep those in my clinic. So the dental cement can actually, you can swallow little tiny microscopic bits of this, and it got up into his brain and caused his Globus Palladus to malfunction. There's another tissue that I didn't mention earlier, I'll mention it now, called the white matter of your nervous system. Your brain is made up of gray matter, and your brain is made up of white matter. The white matter is the motor carrying part of the nervous system. It's in the brain, it's in the brainstem, it's in your spinal cord. What happens when the motor control, just like when the white matter, the motor carrying part of your nervous system, what happens like in multiple sclerosis where they have lesions in the white matter? There is a loss of motor function. So I'm not saying with Parkinson's that there's lesions like multiple sclerosis. I'm not saying that at all. I'm just saying that when the white matter may be infected, what's going to happen to the motor signals that your brain wants to send through this white matter? Do you think it's going to be normal, strong motor control, or do you think we're going to have a decrease in motor control? Again, what happens when the white matter that carries motor signals to parts of your body, what happens when the white matter of your nervous system has an infection like strep infection, or if it has like an Epstein-Barr virus, or if it has mercury toxicity in it? What happens is the white matter is not going to be able to carry these signals at the normal pace, and you can have malfunction of your limbs. He had the staph infection and strep infection in his substantia alba, or I'm sorry, the white matter, that scientific Latin term, substantia alba, in his white matter. He also had those same infections in his spinal cord. He also had the same infections in his cerebellum. In the frontal lobe of the brain, also motor controlling, as well as the frontal lobe working in part with the muscle of the bladder to control the function of the bladder muscle. Not the only part that controls the bladder function, but one of the parts that control bladder function and muscle movements of limbs. He also had those same infections, including scabies, in his frontal lobe, including the other bacteria I've mentioned in the frontal lobe of his brain. How can the frontal lobe, which is part of your cognitive clarity of thinking function, how can the frontal lobe work well with clarity of thought, with moving your limbs appropriately when the frontal lobe is carrying infection? It just can't happen. I'm actually going to, let me pause this video and show you real quickly 1 second of what happens when a toxin can get into, like a mercury, for example, because it's not just infections that can do this, but even toxins like mercury. I'm going to show you, this is a very brief video, so we're going to take a break and come right back. You'll see this video, what this, in the University of Calgary in Canada, what they were able to show that happened to nerve tissue under the microscope. You're going to see this magnified, really incredible, but what happened to the nerve tissue when it came in contact with mercury, like the mercury in your mouth, like mercury in a vaccine. Watch this and I'll be right back.
It is important to note that growth cones in all animal species, ranging from snails to humans, have identical structural and behavioral characteristics. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the denuded neurofibrils seen here.
Okay, that's incredible. You can see the damage that happened to the nerve tissue. What would happen if mercury is in your frontal lobe? What would happen if that mercury was in your globus pallidus? What happens to those tissues and their ability to help control your movements? What do you think is going to happen? Normal or not normal? Not normal. So getting mercury out of the teeth, like some of you may have done already, getting mercury out of the teeth, maybe even some of you have gone through heavy metal chelation treatments. Maybe some of you have done nothing yet with your teeth or with chelation efforts, but maybe you've done the mercury removal from your teeth. Guess what? That doesn't remove the mercury from the brain. What if you've done, which is a good step though, to remove it the right way, but what if you have done chelation, IV or with pills? Nobody who's done that practice with you has been able to inspect your brain like I can, to inspect the frontal lobe and see if there's mercury in there. So when they do chelation through an IV, 20 treatments, 40 treatments, 5 treatments, 10 treatments, whatever it is, or they give you chelation pills, these doctors are not able to tell, even if they've run urine test or hair analysis or blood analysis for mercury, for example, they're not able to tell if that mercury, if any mercury remains in your frontal lobe or in your globus pallidus. I can with my work. In his reticular formation, remember I told you about, it's like lighting the wick on the firework to make the firework go up into the sky. In order for the reticular formation in the brainstem to ignite the thalamus to carry out normal body movements, body functions, as well as sensory, that's part of the situation there, that's part of the function of the thalamus and the reticular formation. But the reticular formation in his body had infection. How can that? It's like wetting the tip of a match and going to light the match. It's not going to work. So how does the reticular formation carry out functions to the body when it's infected? Just like trying to light a wet match, it won't work. It won't work effectively, efficiently. The red nucleus, which carries signals, motor control signals to the body. He also had bacterial infection in there. The substantia nigra, which is a very important part of our brain to help us regulate movements and be happy, because dopamine is part of a euphoric type of chemical in our brain, neurotransmitter in our brain. His substantia nigra, which we needed to be intact to be able to produce dopamine. Not the only place that works with dopamine, but in order to have a lot of dopamine production, substantia nigra is very important. He had aspartame, neurotoxic, fake sugar, synthetic sugar, garbage chemical, aspartame in his substantia nigra, damaging his substantia nigra's ability to produce dopamine. Aspartame is found in sugar-free yogurt, frozen yogurts. Aspartame is found in chewing gum. Aspartame is found in sugar-free ice creams and other kinds of sugar-free products like in, sugar-free drinks and so on. Watch out. Even if you stop chewing gum and stop eating sugar-free foods, you have absorbed, I'm certain, one of many people, everybody, we've chewed, breath mints and so on. They're putting this poisonous chemical into the foods, into certain things that we're eating and consuming. So these absorb into the body. Again, you are what you eat. Just because you stop consuming a sugar-free item, stay away from aspartame products now, that does not mean that aspartame has not gotten into your brain over the years and stayed there and damaging your tissue. I can make a remedy for you if it's there, and I can get that out of your tissue. He also had bacteria inside his substantia nigra, causing the substantia nigra not to be able to produce dopamine normally. His whole brain had aspartame in it, neurotoxic substance. His brain also had scabies. His myelin that covers the nerve and myelinates. Myelin is the covering of the nerve, and it also covers your white matter. We have myelin all throughout our white matter. Remember before I said his white matter was infected? Well, the white matter has a myelin covering, and he had scabies infection in that myelin. What happens? Yes, scabies doesn't only have to come up on the skin, folks. Scabies can get into the body. It's a little tiny itch mite that can get into the body and cause destruction of other tissues, or cause inflammation and cause damage to other tissues in the body. So what happens when the myelin has scabies? What happens when you may not be suffering from white lesions like in multiple sclerosis, but is it just a bit of demyelination, just a little bit, just subtle, to where they're not finding it in the lab, or in their imaging study like an MRI or a CAT scan? But what's going to happen when the white matter of your nervous system that you expect to carry your motor signals from brain to body parts, what happens when there's a little infection that is causing a bit of a disturbance inside the myelin? That is what you need to help the white matter send the signal, the motor control signal through the body. It's not going to work well. He also had a bacteria called Bartonella henselae, which is also known as cat scratch disease, which, whether he got it by being scratched by a cat or not, it's in his body. However he got it, I don't know right now. That's not the most important thing for this discussion. Bartonella henselae in his myelin. The glial cells, another tissue I examined on his first exam with me. The glial cells are cells in your brain, in your nervous system, which repair nerves and reproduce myelin covering for the white matter in the nerves. His glial cells had infection with scabies, Lyme infection, as well as toxic, neurotoxic substance called aspartame. His parietal lobe of the brain, the parietal lobe is really important because it helps us with a number of things, one of which is sensory, one of which is being able to feel where the body is in space. I know my foot is on the ground. I know that I'm touching the floor. It's able to, if my hand is on the desk, okay, I'm able to know where my hand is or my foot is, but and sense things. But the parietal lobe is also important because all your lobes of your brain are friends. And when one part of the brain that depends on its neighbor or friend, when they're not communicating appropriately, we can lose the function in both regions of the brain. So it's important to investigate these parts of the brain. His parietal lobe, which may not be direct for a movement disorder, but it is connected to the other symptom relief that I told you that he experienced after this first round. His parietal lobe had Lyme infection. Whether he got that from a tick or whether he got it from another way in his life, it's there. It was there. It's gone now. His stem cells in his body had scabies infection, E. coli infection. And he also had bacteria in his meninges. Again, when he came back for his next examination, one thing was his bladder frequency from 10 to 15 times a day is now down to 5. The tremor in the lip and tongue are gone. The right leg stiffness, which was at a 2, is now completely gone. The right leg stiffness was a 10, down to a 3. The pain in the right hip is now gone. The stiff neck was at a 5 of severity, now to a 2 or even a 0 on many days. And his spirit is up and his brain fog is gone. Phenomenal from his first protocol. His second examination, I found that the capillaries in his body and brain, capillaries, I'll show you a picture here as well. The capillaries are at least a section of an artist's description of a section of the capillaries coming out of a, they could just cut a section of that and take it out of the brain. That's what you're going to look at right now. Capillaries are blood vessels really important to help us transfer oxygen into tissue and carbon dioxide out of tissue. What would happen if you were driving to work and every day to work you had to cross over a bridge? Let's just say you live in San Francisco and you're driving across the Golden Gate Bridge. What would happen when you got to one side of that bridge, you pay the toll, you get up, and there's cars that are backed up over the bridge and the traffic is not moving? How do you get to work if you have to drive your car across? You're not going to get out and walk and leave your car there. When the bridge would be packed, when the bridge is congested, you're not getting across that bridge in your car. Okay, without some other way of, let's not make up any other story or any other movie scene here, just make it simple. The bridge is packed, you're not getting across in your vehicle, and because it's just congested. So you've got to get from one side to the other. In order for the capillaries, which are bridges between your arteries and your veins, arteries carry blood flow to your brain, to your bones, to your heart, to different tissues, and the veins, they are blood vessels that carry blood away from the brain, away from the kidney, away from the stomach. Okay? The veins carry away, and the veins carry carbon dioxide away. So it's not just, as well as some disinfection, as well as removing toxins, it's not just disinfecting a tissue. You know, if you could just imagine a movie scene for a minute, and now I've got to be a little, I'm going to share about violence here in a movie. If you could just imagine you've seen in a TV show or a movie where somebody is choking another person. Does it matter if that person choked? Does it matter if their brain is infected? Or what's the first thing that really matters is getting the hands off of the neck so they can breathe again. So it's not just about disinfecting, it's about making sure that the blood vessels that bring oxygen to and carbon dioxide out of the brain. Because we got to make sure that we have the right gases in and the other carbon dioxide gas out. So when that person's being choked, what's happening is that oxygen can't get into them and carbon dioxide can't get out of them. So people can die that way, okay? So by being choked. So it's not just about a toxin that's there. It's not just about an infection that's there. We've got to make sure the blood vessels that carry blood to, oxygen to, and infection out of, that they're clean. So we went in this exam, his capillaries with Candida. Candida albicans was found in his capillaries. Remedies will clean that out of there. I found in his cerebellum had dental mercury in it. Let's take a break again and watch this one more time of this mercury, what they did in University of Calgary. This will just take a few more minutes. I just want to help you realize and make an impact on you about how the mercury can actually destroy the tissue. We're getting the mercury out with this work, with these remedies, getting the mercury out, the kind of mercury, we're getting it out of that tissue. And I have 11 different samples of mercury. So let's watch that video again.
It is important to note that growth cones in all animal species, ranging from snails to humans, have identical structural and behavioral characteristics. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the denuded neurofibrils seen.
Okay, now we're back. I'm going to tell you, so you can see the destruction that happens to the nerve tissue in the brain, in the spinal cord, anywhere in the body can happen from mercury exposure. His cerebellum also had Lyme infection in it. His reticular formation, remember before about lighting the wick or the match to be able to light that thalamus to send signals up to the brain, the cortex of the brain. His reticular formation, Lyme infection. His Globus Palladus, which is the leash or the reins, the leash on the dog or the reins on the horse, Globus Palladus, Lyme infection. His brain had, overall brain had more strep infection that we're getting rid of, as well as Lyme infection. I'm sorry if I said Lyme infection. To get that out of his brain. The substantia nigra, which is where those dopamine producing cells, Lyme infection in his substantia nigra. The remedies are prepared for him to send him, for him to follow this protocol at home. I won't see him for 60 days after he does his protocol. So we're talking maybe 2.5 months or so after meeting with him that I would be able to see him again and follow up with you and follow up with everybody, follow up with him, his wife, to see that the exercises I've given him, specific, pinpointing to specific parts of his cerebellum, as well as these remedies that we're making for him, to be providing him to be able to get these infections and toxins out of the blood vessels, out of specific parts of the brain, to see his recovery. I will report to you when the follow-up is done with this gentleman. Listen, the bottom line here is, which your neurologist and even the top neurologist in the top university may not be, or top hospital may not be sharing with you, is that there are specific infections and toxins that can get into your body, into your brain, and cause your brain to malfunction. That's it. That's the reason. That's the cause of the malfunction. So I'm here to help you get this done, find it, inspect it, remove it, and get you to restore function to your body, and it can be done. Right now, you can call my clinic at 954-370-3100, 954-370-3100. You can even send an email to my assistant, my office assistant, who's happy to help you. She's very nice and lovely and help schedule your appointment for you. Like me on my Facebook page. I share information on Facebook on a regular basis. There's some information I have not put up in video form on my YouTube channel that's on my Facebook page. If you're on Instagram, follow me on Instagram. And subscribe here on my YouTube channel. And you can actually just go right down to the bottom button here on the side of the screen and click on that. If you're logged into your YouTube account, you can subscribe there. And every time I put up a new video, you'll have an email that comes to you that says, new video from Dr. Herman is online, basically. Just to tell you that this type of care is not covered by your insurance company. Insurance companies don't recognize anything outside of your policy. This is not something that they've recognized as work that they're going to cover. So this is something that's out of your pocket. This is something that you can discuss with my assistant to find out the charges and how to set up appointments here. And people fly into my clinic from all around the world, literally. I've got patients from New Zealand, Thailand, from Belgium, from Netherlands, from Norway. We've had people come from Italy. We've had people from Canada. I've had people come from many different places into my clinic, even across the U.S. So I'm here to help you. I'm here to help you find and pinpoint and safely eliminate these various infections and toxins that your doctors aren't finding, to remove these hidden disease-causing agents from your brain and other parts of the body that are causing your symptoms. And we're going to see your symptoms start to disappear. For one person, it may take longer. For one person, it may happen sooner than later. It just depends on the individual. Okay, again, you can call my clinic at 954-370-3100 or email my assistant. And also make sure that you share this video with one loved one, one friend, one person. Just easily click the icon or the button on your phone or on your computer. Share this video with one person. It's very simple, because you never know how you may have an impact to help save somebody else's life. Thank you. See you soon.